Welcome, student, for your first day for all session. In this session, we will be trying to cover Unit 4.1 and 4.2. In this, we will be trying to tell you about the specification about nervous system. So that is the introduction which we needed at the most because you should know when you are trying to deal with any cases, what will be the normal biology or the anatomy behind it. So we will be trying to take the nervous system and the introduction, a brief about all the important structures over it. And next we will be moving into the head injuries, concussion, head fractures, skull fractures, or the stroke. So this all the emergency situation we will be trying to cover in this session. So just stay tuned and remember, in case of any injuries or anything suspecting you feel like the person who may going into that particular condition may have that condition, kindly as fast as possible reach out to the medical care facilities and give them the required treatment. Let's begin with. So as you can see in this picture on the side, you can see it is labeled as a brain, spinal cord, and the nervous system. So a nervous system will be consist of these three important parts. That is the brain, spinal cord, and the nervous nerves or the bunch of nerves. We can usually name it as plexus as well. So this is anatomically divided into the central and the peripheral nervous system also. So as you can see, the brain holds the highest most part of the body. So whatever is the information which has to come to the brain only. So whenever you are trying to touch, for an example, if you are trying to grab a glass of cup, filled with water, maybe the warm water kept on the table. So you want to take it up, and when you are that your brain will give you the information that you are thirsty, hence you need a glass of water. They will give the information to the spinal cord, and spinal cord then pass on the information to the nerves. And nerves, wherever they are inverted, like innervated for the muscles, they will give information so that they will do the voluntary movement, and then we are grabbing the glass of water. But we don't know whether it is warm or cold. The sensation of when we touch to that particular cup, then we know it is a warm one. Then the nerves, the sensory receptors which are there in that, or our skins, they will give the receptor stimuli to the nerves. Nerves then travel to the spinal cord, and then as fast as possible they reach to the higher center, that is our brain. And from brain, when they process it up, they give back the information to the spinal cord, and from the spinal cord it comes down to the nerves and then to the muscles, giving information that this is warm. Then we have to be careful, we don't have to drink so fast. So these all are being processed in a very systematic way. It will be moving on. So whatever the information that you are grabbing, in which there are movements or there are the things, the messages has to be traveled to the brain. It will be travel in the coastline of nerves, spinal cord, and the brain. And even when it is descending and getting the information passed to you, it will be coming from the brain, spinal cord, and nerves. So these are the bifurcation, and this is how the system works. Now let's see what is central and peripheral nervous system. Central nervous system is nothing but comprises of the brain and the spinal cord, the main head of the area which take control and give the feedback what to do or what not to do. Next is the brain. The brain, that means the topmost part. The brain is extremely delicate structure made up of mass of cells, and here is sensation are analyzed and orders are given to the muscles via the spinal cord and the nerves. So this is how the brain normally works. The brain is encased inside the skull and suspended in the clear fluid. So if you can see, brain is a very important structure which need always a kind of protection. As we know with the heart, heart has been protected by the rib cages. Inside the rib cage, we have heart as well as lungs, which are very much protected in that inside that cage. Same way, we need the brain as well to be getting the protection. Hence, the protection is given by the skull. So skull is a very hard bone. After the mandible, which is we can find on the jawline, after that, that is the main thing is the skull. Skull is the most strongest bone which we can see in the body, which will be helping the skull to be the brain to be there inside it and being protected. Just the very hard blow, which is the direct one, or very with the very force blow only, there will be some sort of bone fractures or skull fractures which can happen. And applying to the bone, there will be something known as cerebrospinal fluid, which is being suspended inside the skull, and the brain is over it. So this is the cerebrospinal fluid is nothing but as a partial shock absorber. So any sort of direct blow to the head, or any time when we have hit a wall with our head, we feel like some sort of numbness over that time. So that is nothing but the fluid is becoming vibrant at that moment, trying to make the brain out of that pressure and just trying to stimulate only towards the fluid area. This will create the brain to be in a safer zone, not being shaken up in that. The three main structures are cerebrum. It is always concerned with the thought, sensation, and the conscious movement. So, whatever information that we are getting up, like where whatever imagination we are doing, what is the sensation we are taking up, those are being covered and controlled by cerebrum. That is a part of brain. Next is cerebellum. Cerebellum is mainly used or control the coordination, the posture, and the balance. Coordination are nothing but when you are walking, your legs are moving simultaneously just to propellate you to the front. Same way, our hands are also swinging along with the swing of the leg. So these are the coordinated movement or the associated movement that the body does. Also, if you want to try to put down a point in our air, like this is somewhere it can be there, and the same way we want to pin out the other part also where the already the pointers have been pointed out. If you try to correctly take that particular point, that means knew that area, we knew the distance, and we appropriately pointed our finger there. That is known as the coordination. Balancing, as you know, when we are trying to stand up or we are falling down somewhere, we are trying to put up our body pressure to the center area of our body, center of mass or center of gravity, we can say, of our body, and try to maintain the balance. And posture, again, everyone is now in a relaxed position, hence there are a lot of problems which we can get it up. Posture is also very, very much important. There are people who walks with the scoliosis, with a very twisted spine. Those are being areas where cerebellum may work, but the problem is with the anatomical structure being a problem, it may not be the reason for the cerebrum in that area. Now, now next is the important part is the brainstem. Brainstem alone carries the function of the respiration. So any kind of problem with the cerebrum, brainstem over this area, any injuries towards it or any tumor over there can suppress the respiration area, and the person may die with the respiratory failure or reduce of the shortness of the breath, just because the main part, that is the brainstem, being affected. So these are the three important part of the brain. Now let's go to the spinal cord. The spinal cord is a mass of nerve fibers extending from the brain through this opening on the base of the skull. The cord runs into the spinal column. The main function of the spinal cord is to convey the signals between the brain and the peripheral nervous system. As you can see in this particular diagram, this you can see it's the down part of the brain. So if you can see, this is the brainstem and this is the cerebellum here on the backside, and here is the spinal cord coming out of the brain. So from the opening in which they have mentioned, opening in the base of the skull, that is nothing but the foramina. That is the name of the place where the uh, spinal cord will be coming out of the brain. So the when it is coming out of the brain, you can see a lot of distinction over here. So they are nothing but the nerves coming out of the spinal cord. Every area of the spinal cord will be having its own nerve. For example, if it is a neck area, we usually call, in the terms of medical, we call it as cervical area. The neck area where they will be having the cervical nerves. So if you go down after the cervical area, we have you can say thoracic area, which is covering the chest part of it, which have 12 different vertebrae in this. So inside that, there will be 12 different nerves which will be coming out, pair of nerves, I can say, because both side it comes out. So they will be having the thoracic nerves, followed by lumbar, is our low back area, the lumbar nerves, and the at the end, if you can see, it is the sacral part. So say when it reaches to the sacrum area, that is below the lower back area, the tapering will be of happening of the spinal cord, and the nerves which is coming out will come into the plexus form. So sacrum, if you can see, it's a five different vertebrae fused into one bone. So it is just a one bone, but there are five vertebrae inside it. But it's just it is fused. So we usually call sacrum as one bone, but having the five different fused vertebrae. So the plexus, that means the bunch of nervous system or the nerves, will be coming out of these five different holes of the vertebrae. So this is where the tapering happens, and the end will be that from the tapering of the spinal cord. So this is the normal structure of the spinal cord along with the brain. So if it is clear, and then we will go to the peripheral nervous system. Peripheral is nothing but the distal area. Distal is means which are far from the center point, like our hands, our feet. All those are peripheral areas. So the peripheral nerves emerge in pairs, each containing the motor and sensory from the brain and the spinal cord. So from the center area, whoever is coming out of the areas, that will call as a peripheral nervous system. So they will be having the pair of motor as well as sensory nerves. So the motor and the sensory nerve will be doing the two different jobs in this. Motor will be doing the motor consents. For example, if you want to take a glass of water, that is your motor. You voluntarily want to do it. And you, when you touch it, it is warm. Then it is the sensory nerves which have been acting on it. So there we always have every each and other pair of nerves will be coming out, either the sensory or the motor. They will go hand in hand because every part of our body is moved to be sensitive. So we should know what is the temperature, we should know what we are touching. So we should know what we are touching. Is it a jelly, or is it hard, is it soft, is it firm? Everything we need to know. So hence the sensory aspect of the particular area is very, very, very much important. Next is peripheral nervous system can be divided into voluntary or somatic nervous system or autonomic nervous system. Somatic nervous system, if I can tell you, is a part of the peripheral nervous system that is responsible for carrying the motor and sensory information to and from the central nervous system. That is, whatever they are carrying the information from the brain or the spinal cord or to the brain or spinal cord, anyone, or is like vice versa. So you can they are the areas where we usually do the motor movements, and the sensory information will be going towards the center part, that is the brain and the spinal cord, and they will bring back the same. So that is why we are calling it as somatic nervous system. And we have autonomic nervous system, which is the part of peripheral nervous system which regulates the involuntary function of the brain, of the body. For example, our heart is beating without we being knowing or we being telling them. Correct. So they are the involuntary responses which we have. Same like we are breathing. We can control the breathing for some time, but forever, no. Forever for the time of 3 2 minutes, no. So these are like involuntary. It will happen in our body time to time. So this are been regulating our life. So basically, the things are involuntary are the heartbeat, you can say. And when you eat something, the food is coming down to your throat and then going to your stomach. So when the stomach it will reach, the food is coming with a chewed view. Everything which has been chewed, it will be coming to the stomach. From the stomach, there will be the absorption happening for the important vitamins, minerals, and all this protein, carbohydrates, glucose. Everything will be trying to gather up and absorb it along with the time wherever it is passing through. From the stomach, it has to go to the intestine. So when you wanted to go, there will something known as peristalsis movement which happen, which is involuntary, because when the food goes inside, then only it will get activated. Peristalsis movements are nothing but they are pushing the food to the next segment for the absorption part. So that is the involuntary function. Voluntary functions are nothing but which we have controlled in, and involuntary functions are those which we don't have any control over it. Now let's come to the pathology part of it. That is first and foremost is our head injury. So the head injuries can be a concussion, or it can be a cerebral compression, or a fracture or a skull of the skull. All the head injuries are potentially dangerous and require a proper assessment because they can impair the pair of sensation, the consciousness as well. So when you see a person having a head concussion or head injury, or he banged his head, he might not remember what happened, or he will be alert at some time, but he will be slowly deteriorating his consciousness. So we have to be very much aware about all these aspects. Head injury can be associated with damage to the brain tissue itself, damage to the blood vessels inside the skull, skull fractures, and brain concussions and compression of the brain tissue because of the build of the pressure due to the swelling or the bleeding. This is very much important when you have any kind of a brain injury. So what happens, there will be the fluid which is there inside will be increasing the pressure because of the asymmetry of your brain. Sometimes because of any kind of a blow on your head, the structure of the brain can also go for a problem. So maybe the structure may not be the same as it was before. So therefore the surface area has become less and the pressure will be building up way too much. So that can also cause the pair of swelling and cause of the bleeding. Now concussion. Concussion is nothing but you are been shaken up the brain inside the skull. It can be caused by the blow to the head or the floor. There is a brief period of the impaired concussions consciousness following the blow to the head. Again, sometimes person will not remember what happened to them at the time when they were having a fall, or even during the 32 minutes before and after, they won't remember what happened. So this is like they are loss of some of the memories which are very important at that time. They won't be remembering it because of the concussion which has happened on their brain. The casualty might complain of dizziness. They might feel they are about to fall down. They might have headache. They might not see the proper vision. The way they might have the blurred vision. They have even have the nausea. Typically, there is a brief loss of memory of an event, as I told you, presiding or immediately or in the time of injury. Next is skull fracture. If the casualty has a wound or the bruise, be alert for any possible skull fracture. Also, the skull fracture is a serious condition because of the underlying risk of brain damage and bleeding. So, what all the signs and symptoms we have to see for? First, see is there whether any depression area are there on the scalp or not. There is an asymmetry whether the skull is of same size or it is have been different in the size or the shape. There is a bruising or swelling behind the ear. We have something known as mastoid process, which is right behind the ear on this area. So that area can also have a swelling and bruising, which can be a definite about any kind of a skull fracture. A clear watery fluid or the blood coming out of your ears or nose, then that is a very much definitive that there is some sort of opening in the skull, with the hence there is a bleeding towards the orifices. So we have orifices on our eyes, nose, mouth, and ears. So if there is any kind of opening in the skull, so there will be the CSF will be ooze out, or even the blood will come out over from this area. The casualty will have the deteriorating level of responses and the consciousness. First, they will be very much alert, and next, in the presiding times, they will be having a loss of consciousness, or they can be confused, or they will be in delirium, or they can be in stupor. So these are the different alteration in the consciousness level. So what to do in that situation? If you find a potentially serious injury, if the person is falling out from the height which is greater than his height, maybe the person is 5 feet and is falling from the 7 feet height, then you can suspect a potential serious injury, and was involved in the road traffic accident and suffered a very hard blow towards his head. Feeling nausea or vomiting. It's a very, very common thing. It does not remember exactly what happened, loss of memory at that moment, is behaving irritated or unusual way after the accident. Next is complaining of blurring the vision, feels a pain or the tenderness of the head, neck, and back, feels like the injuries to the, has a serious injury to the head, has a serious injury on the leg but does not complain about because moreover he is feeling more to the head area. Even if there is any injury towards the spinal cord also, he won't feel anything to the leg. Maybe the sensory part might have cut off. He feels like he is being cut into half. He will be sleepy, drowsy, and there is a alteration in their consciousness. May have a fit can also a seizure can also happen at this moment because following any kind of a head injury, and also have an unequal pupil size. Sometimes pupil size, when we try to check it with the torch with the right reflexes, they might not show any kind of contraction because of constriction, as we can say. So when you put a torch light on the eyes, pupil has to constrict so that the left, because we don't want this much big pupil constriction, a dilated pupil to let inside the light rays this much. So when the light is more, our pupil go for a constriction. But if the person is not at all responding to this kind of light reflex, then we can see there is some serious effect on the brain. Now, tap him in the shoulder and ask whether he is okay, but do not shake the patient roughly. Maybe it can cause any further damages or worsening the condition. Check the injured person is conscious or unconscious and act accordingly. Consciousness, we need to act differently, and unconscious situation, we need to act differently. To do so, if the persons open his eyes and responds to the simple question, for example, what is your name? Where do you live? How old are you? If these are, they are able to say that, we can say that they are responsive. If the person, if injured person to the simple command like squeeze my hand, move hand, the arm, leg, foot, anything, if they're following the command, then we can say that they are responsive to the command. If there is no response in the above two measures, then you have to pinch just to see whether the person is reacting to the pain or not. If the injured person responds, do not try to change the position of the when they are having any kind of head, neck, or spinal cord injury. Now, this is the situation where you will be standing near to the patient and then asking the questions. Tell the person to be calm and do not move. Assure that you will be stay with him and make sure that he has arranged some kind of a medical facility or the ambulance to further for come and help them out. Now, head is very much important. If you suspect anything, try to make it as still as possible. To keep the head still, place your hands or lie tightly folded clothing on each side of the person's head. Keep the head and neck of the person still only if the person is allowing you to do so. Some person will not allow them to do anything to them, that they feel fear. So that hence we have to make sure if the person is not allowing, do not do anything. If the injured person doesn't allow it, don't enforce them to do any sort of work. If the spinal cord injury is suspected, then you should continue to ask the person to lie down until the transportation has arrived. Injured person should not made sit or stand. Any kind of twisting and turning to the spinal cord may have a worsening of condition. At least three people has to assist in when move it up. It should move like a log. One person will be holding to the neck area, one will be to the thorax and pelvis, and one will be to the pelvis and the leg. And in the one, two, three, go. So three, when you say go, everyone has to stand up, holding the person up. In the case of disbalance in the command and propering moving it or transferring it up, the person can worsening the condition, making the spinal cord even more problematic. This is the way you are warming up and making the head in still position. Keep the injured person by taking off the wet clothing, covering up with a blanket and other, but do not overheat him. We just want him to be warm. Do not, if you are not yet done, arrange the transport facility. Do not leave the person alone. You have to keep on checking on his breathing and conscious level, and do not give anything for drink and eat. Next is very important is the stroke part. Stroke is a rapid loss of brain's function due to the disturbance of the blood supply to the brain, and it can be result of the bleeding or when the blood flows to the blockage to the blood vessels to the brain. Here, what you have to do and inquire at this moment. You observe following signs and symptoms. First will be the complaint of numbness, blurred vision, speech will be slurred, it complains of severe headache, a person seems very much confused. So in this kind of situation, you can make sure the person may have the stroke. So what you have to observe? Weakness of the paralysis of the limb, or over the face as well. Sometimes they have loss of consciousness also. So the possibility of stroke should also be taken considered when a sudden weakness and the numbness of the face, arm, and leg are being specially on the body has been observed. A sudden trouble in making to understand what is happening and even to stand, making their faces up. So first and foremost is the fast. Fast is nothing but face, arm, speech, and transport, or the time. Time in transport, we can say. Fast, for the F, we have to ask for the facial structure. As we said, there will be a weakness or paralysis of the face. We have to ask the person to smile or show the teeth. If you can see in this picture, the person is not able to lift on his left side of his face. That means he might have a paralysis or the weakness of the left side of his face. Check whether the mouth is crooked or dropping into the one corner, as you can see in this picture. There is might be saliva dripping out of the mouth because there is no control of this one side of the mouth. That's why. Next is your arm. Ask the person to lift both the arm. See if the person is able to lift one arm. His right side is technically very much okay, but is trying to lift on his left hand as well, but they are not able to lift it up. And even if they are lifting, check whether the arm is dropping or drifting away if the one arm is lower than the other one. Sometimes the shoulder can also go in a lower position. The stroke often causes one side of the body to become weak and even paralyzed. The person might also have lost his balance also. Now next S is speech. Ask the person to repeat a simple sentence, see whether he is having any problem with his words when he is saying. A stroke is very likely if the person has difficulty with any above actions. T is transport in time, or we have to arrange the facilities very much quickly because as fast as he is reaching to that area, faster, the quicker will be his recovery. So, time and transport is very, very much important. If you think the person suffered from a stroke, a person urgently need to call help. Shout for anyone help over there, but do not leave the person unattended. If there is a bystander, ask them to call for the ambulance and wait until he gives a confirmation. If the person can sit up, make him to sit up, but otherwise let him be in the recovery position. Explain what is happening to them, make them relax. Do not let anything to eat, or maybe it can go for choking. So no drinking and eating to this person. Next is keep the person's checking if whether is awake and breathing properly and arrange the facility as fast as possible. After all this, hygiene is important, so just wash your hands, keep it safe by using the sanitizer. Now, in this case, the person is conscious. As I told you, in unconscious state, it will be entirely different, but the person is breathing. That time, just put him in the recovery position, just lay him down and observe the breathing and check his consciousness level also, whether he's gaining the consciousness and wait for the ambulance to arrive. This one is the very important one. What if you have to do if the person stops breathing, which is the very important and the last part of our session. Today's session will be to if the person is not at all breathing, immediately start with CPR. You do not see here and there, just start it with it. Do not interrupt the resuscitation until the person wakes up and speaking with you and breathing by himself. If the CPR person, the trained person or paramedics have arrived, or the last one if you are too exhausted to continue, or the area become unsafe for you to continue the same process. Thank you so much, students. I hope you are very much aware now things how what you need to do when there is a head injury or skull injury cases, and even when the stroke cases are being given out there. So in these cases, you will have to be very much secure, like how you have to do all the stuffs and how you have to make the right call to call the paramedics or the ambulance to come and rescue it as fast as possible. Thank you so much. We will be meeting on our next session. That will be our last session where we will continue about the emergency situation, also the areas where you are talking about the seizures or epilepsy as well. Thank you so much, students.